Are you experiencing new health challenges now that you're over 60? Things that once felt easy now take more effort, and sometimes subtle signs of bigger issues go unnoticed until they become serious problems. But imagine catching these early signs before they escalate, ensuring many more joyful years ahead. Welcome to mtwisdom, where today we're exploring common ailments and crucial warning signs for older generations and simple ways to manage them proactively. By understanding these, you're choosing empowerment over uncertainty. Think about arthritis, something many of us dismiss as mere aches and pains. Consider Alice, who at 72 began noticing her hands feeling stiff, especially in the mornings. She struggled opening jars, assuming it was normal. But arthritis, whether osteoarthritis or rheumatoid, isn't just a discomfort, it can severely impact your independence. Osteoarthritis, often due to aging and wear and tear, gradually wears down the cartilage cushioning your joints, causing friction and pain. Rheumatoid arthritis, on the other hand, is an autoimmune condition where your immune system mistakenly attacks your joints, leading to inflammation, swelling, and eventually deformity if untreated. Alice realized her stiffness was becoming a real problem when everyday activities like buttoning her shirt or holding her coffee cup became increasingly painful. She began to isolate herself socially, embarrassed that simple tasks now felt daunting. This experience is common. Arthritis can silently lead to decreased physical activity, reducing muscle strength and further worsening joint health. The good news is that arthritis doesn't have to dictate your life. According to Harvard Health, there are practical and effective ways to manage arthritis pain and improve joint function significantly. Regular gentle exercises such as swimming, cycling, or even simple stretching can make a world of difference. These activities strengthen the muscles around your joints, reducing the load and minimizing discomfort. Walking, while beneficial, shouldn't be your only exercise, as it doesn't fully challenge or strengthen all the necessary muscle groups to support your joints adequately. Weight management is also crucial in combating arthritis. For every pound you lose, you take approximately 4 pounds of pressure off your knees and joints. Think of it this way: shedding just 10 pounds can relieve 40 pounds of joint strain, making everyday movements easier and significantly less painful. Another critical tool in the fight against arthritis is ergonomic support. Ergonomic devices such as specially designed jar openers, padded handles, and lightweight utensils can drastically reduce joint strain. Alice, for instance, discovered ergonomic gardening tools, enabling her to return to her beloved garden without fear of pain or further joint damage. Additionally, using heat or cold therapy can effectively manage arthritis symptoms. A warm bath or heat pack can loosen stiff joints in the morning, making movement easier, while a cold pack can reduce swelling and inflammation after activities. Right now, try gently flexing your fingers. Does it feel challenging? Don't worry, you can start simple exercises today, gradually increasing your joint flexibility and strength. If arthritis is beginning to affect your quality of life, it's essential to consult your healthcare provider early. Prompt intervention, personalized exercises, proper nutrition, and supportive tools can help you maintain your independence and continue enjoying life to its fullest. Leave a like if you found this information helpful. Moving forward, asthma isn't only a childhood concern. Meet George, 74, who suddenly found breathing challenging during colder months. Unknowingly, he was facing late-onset asthma, a condition often overlooked in older adults. Unlike childhood asthma, late-onset asthma typically begins after the age of 50 and is frequently associated with environmental factors or respiratory infections. George initially assumed his breathing difficulties were just part of aging or perhaps due to a common cold. But his persistent shortness of breath, especially when exposed to colder air or allergens, became impossible to ignore. Asthma in seniors can indeed be quite different from younger people's experiences. Older adults may mistake asthma symptoms for normal signs of aging or attribute their shortness of breath to heart conditions or being out of shape. However, asthma at this age can trigger severe breathing complications, making simple daily tasks exhausting and uncomfortable. Furthermore, exposure to unfamiliar environments, especially during travel, can exacerbate asthma symptoms due to new allergens, irritants, and changes in climate. George discovered that travel could significantly affect his breathing, as different locations exposed him to unique triggers he hadn't encountered before. Air quality in hotels, pollen levels in new cities, and even simple climate differences posed real challenges. What made a real difference for George was identifying his triggers, which included cold air and pollen, and learning to manage them effectively. Doctors recommend seniors with asthma regularly monitor their lung function using peak flow meters. This straightforward device can measure how well air moves through your lungs and can detect changes in your breathing ability even before symptoms become noticeable. For George, regularly checking his lung function allowed him to anticipate problems and adjust his activities or medication proactively. Treatment usually involves using inhalers that deliver medication directly into your lungs. Preventer inhalers reduce inflammation and sensitivity in the airways, helping control asthma long-term, while reliever inhalers quickly open up airways during sudden flare-ups. George's doctor emphasized the importance of carrying his reliever inhaler at all times and using his preventer inhaler daily, even when he felt fine, to maintain better overall lung health. If you've experienced sudden shortness of breath or persistent coughing, don't dismiss these symptoms. It's essential to consult your doctor promptly. Simple steps like recognizing triggers, regular lung function monitoring, and appropriate medication can dramatically improve your breathing, making daily life easier and much more enjoyable. Then there's cancer, a word that often brings fear, yet early detection drastically improves outcomes. Susan, 75, felt fine, except she began losing weight unexpectedly and noticed a persistent cough. Thanks to regular screenings encouraged by Cancer Research United Kingdom, her lung cancer was detected early, significantly boosting her chances of successful treatment. Cancer is particularly concerning for older adults because age itself is a significant risk factor. As you age, cells have had more time to accumulate damage, and the body's natural repair mechanisms become less efficient. This combination makes seniors more susceptible to various cancers, including breast, prostate, colon, and skin cancers, in addition to lung cancer, like Susan experienced. Early detection through regular screenings cannot be overstated. Mammograms for breast cancer, colonoscopies for colorectal cancer, prostate-specific antigen tests for prostate cancer, and regular skin checks for skin cancer are proven ways to catch cancer early when treatment is most effective. Susan's early detection was not a stroke of luck, it was a direct result of her proactive approach to regular screenings, underscoring the importance of these preventive measures. Beyond screenings, awareness of subtle but significant signs is critical. Sudden, unexplained weight loss, as Susan experienced, is often an early indicator of cancer, including gastrointestinal, pancreatic, or lung cancer. A persistent cough lasting several weeks, especially if accompanied by blood or shortness of breath, is a red flag warranting immediate medical attention. Other symptoms such as persistent fatigue, unexplained bleeding, changes in bowel or bladder habits, or the development of new lumps or skin changes should also prompt timely medical evaluation. Lifestyle modifications can also play a significant role in reducing cancer risk. According to Cancer Research United Kingdom and the American Cancer Society, avoiding tobacco, limiting alcohol consumption, maintaining a healthy weight, staying physically active, and adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can substantially lower cancer risks. Protecting your skin from excessive sun exposure by using sunscreen and protective clothing also decreases skin cancer risks significantly. Managing your emotional health is equally important. A cancer diagnosis or even the suspicion of cancer can understandably trigger anxiety and emotional distress. Engaging with supportive family, friends, or professional counseling can ease this emotional burden, ensuring better mental health and more effective participation in treatment plans. If you're concerned about your risk factors, or if you're experiencing any symptoms like Susan's, don't wait for more obvious signs or pain to act. Speak to your healthcare provider about appropriate screenings based on your age, family history, and lifestyle. Early intervention is the best chance to ensure successful outcomes. Remember, sudden weight loss or unexplained lumps deserve immediate attention. Protect your health proactively, don't wait for noticeable pain. Share this information with family and friends who might benefit from recognizing these subtle cancer warnings. Now, let's talk dementia. Frank, 80, seemed forgetful about little things, dismissing it as typical aging. But soon, everyday tasks like managing his finances became confusing. Dementia, however, isn't just ordinary forgetfulness, it's a decline in cognitive abilities that significantly interferes with daily life. Recognizing dementia early, as emphasized by Mayo Clinic, can greatly influence how comfortably you live your later years. Dementia encompasses a range of cognitive impairments, including memory loss, difficulty communicating, impaired reasoning, and altered visual perception. Alzheimer's disease is the most common form of dementia, accounting for approximately 60 to 80% of cases. Unlike normal age-related memory lapses such as forgetting a name but recalling it later, dementia involves persistent, progressively worsening symptoms that affect everyday functioning. Frank initially thought losing track of conversations or misplacing items occasionally was just part of getting older. However, his family started noticing more significant changes. He struggled to keep appointments, forgot important family events, and began to experience anxiety over routine tasks, such as paying bills or grocery shopping. These challenges made Frank increasingly dependent on family, affecting his sense of independence and dignity. Early detection of dementia can profoundly impact your quality of life. Identifying symptoms in their initial stages allows for timely interventions and planning, helping individuals and families manage the condition more effectively. Medical professionals can assist with diagnosis through cognitive assessments, neurological exams, and medical imaging, enabling a clearer understanding of the extent and type of dementia. Engaging in regular cognitive stimulation is critical in slowing the progression of dementia symptoms. Activities such as puzzles, crosswords, reading, playing strategic games, or learning a new skill help keep the brain active. Structured routines and consistent daily habits can also greatly reduce confusion and anxiety in individuals with dementia. Keeping regular meal times, daily walks, or scheduled social interactions provide predictability, helping those affected feel more secure and stable. Social engagement plays a crucial role in managing dementia as well. Social interactions, whether through family visits, group activities, or community programs, provide necessary emotional support and cognitive stimulation. Studies indicate that individuals who maintain robust social networks experience slower cognitive decline compared to those who become isolated. Even simple conversations and social outings can offer significant mental health benefits, enhancing overall well-being. Home safety modifications are also essential to consider for dementia management. Implementing practical changes such as clear labeling of household items, installing safety rails, securing loose rugs, and using automatic shut-off appliances can prevent accidents and improve daily functioning. These modifications make it easier for individuals like Frank to navigate their environment safely and independently for as long as possible. It's important to monitor nutritional health in dementia care, as forgetting to eat, difficulties preparing food, or loss of appetite can lead to significant health issues. Easy-to-eat nutritious meals and regular hydration can greatly improve physical health and cognitive function. Try recalling today's breakfast. Any difficulty? Regular mental activities help immensely. If dementia concerns you, remember proactive management can significantly enhance your quality of life. Lastly, diabetes often sneaking in quietly. Margaret, at 72, noticed she was unusually thirsty and fatigued. She brushed it off as aging, but these were early diabetes signs. Diabetes, especially type 2 diabetes, often develops gradually, making it easy to overlook the initial symptoms. However, early detection and management are vital to prevent more serious complications such as cardiovascular disease, kidney problems, vision loss, and nerve damage. Diabetes affects the way your body processes glucose, an essential energy source for your cells. When you have diabetes, your body either doesn't produce enough insulin or can't use the insulin it produces effectively. This results in elevated blood sugar levels, which over time can cause serious health problems. Margaret initially didn't consider her symptoms significant. Like many older adults, she thought fatigue and increased thirst were normal aspects of aging. Yet these signs were her body's way of alerting her to elevated blood sugar levels. Other common symptoms include frequent urination, blurred vision, increased hunger, unexplained weight loss, slow healing sores, or frequent infections. If you experience any of these symptoms, it's crucial not to ignore them. Controlling diabetes effectively involves several critical lifestyle adjustments. Diet management is fundamental. Eating balanced meals rich in fiber, such as whole grains, vegetables, and fruits, helps regulate blood sugar levels. Reducing the intake of refined sugars, processed foods, and excessive carbohydrates is equally important. Small, frequent meals can help maintain stable glucose levels throughout the day. Regular physical activity significantly improves the body's insulin sensitivity, making it easier for glucose to enter your cells. Simple activities like walking, swimming, or gentle stretching exercises for at least 30 minutes a day can greatly improve blood sugar control. Before beginning any new exercise routine, it's wise to consult with your healthcare provider to tailor activities to your physical capabilities and health status. monitoring blood sugar regularly provides crucial insights into how well you're managing diabetes. Frequent checks, especially before meals and at bedtime, can inform necessary adjustments in diet, physical activity, or medications. Many modern glucose monitors are user-friendly and offer easy ways to track readings over time, providing valuable data for you and your healthcare provider. Hydration plays a vital role too. Increased thirst, one of Margaret's initial symptoms, indicates your body's attempt to flush excess sugar from your bloodstream. Drinking adequate amounts of water throughout the day supports kidney function and helps maintain balanced blood sugar levels. Routine medical checkups are essential for early detection and management of diabetes-related complications. Regular appointments allow healthcare providers to monitor your blood pressure, cholesterol levels, kidney function, and eye health. Early intervention can prevent minor issues from escalating into significant health problems. If you're experiencing frequent thirst, unexplained fatigue, or other symptoms described, don't wait to seek medical attention. Diabetes management is highly effective when initiated early, significantly reducing the risk of severe complications and improving your overall quality of life. Share this information with family and friends who might benefit from proactive diabetes management. Ultimately, it's not merely about adding years to your life, it's about adding life to your years. Small changes today can profoundly impact your future. Don't wait until it's too late. Proactive health management is your best companion. If you found today's insights valuable, hit like and subscribe. Gently tap the bell icon to stay informed. If someone you love could benefit from knowing these signs, please share this video with them. I'd love to hear your thoughts. Comment below which topic resonated most with you. Remember, your quality of life is precious. Let's nurture it together. Thanks for watching MT Wisdom, where wisdom meets care. See you in our next video.